Lay an unresponsive breathing diver left side down, head supported and breathing oxygen, like you learned in Section 3. Don't delay first aid in getting the diver to treatment, which requires recompression in a chamber. The faster treatment begins, the lower the risk of permanent residual symptoms. Although decompression sickness is a serious condition, you reduce the risk by properly following established safe time and depth limits. You avoid lung overexpansion injury by breathing continuously and never holding your breath. Part of avoiding both includes making a slow ascent, with a short pause at 5 meters, 15 feet, called a safety stop. You'll learn more about these in Section 5. If your body tolerates only a certain level of excess nitrogen, how do you know what that level is, and how do you stay within it? By guessing? No, you use dive tables and computers that express a mathematical decompression model developed to track the theoretical amount of nitrogen in your body. But keep in mind that you're applying a mathematical model. Theoretical models can't account for individual variations, so stay well within the limits predicted by your tables or dive computer, especially if any of the secondary factors you learned apply to you. Remember, because people differ in their susceptibility to decompression sickness, no dive table or computer can guarantee that decompression sickness will never occur, even though you dive within the table or computer limits. Plan your dive well within limits and the risk is minimal. But the only way to avoid all risk is to not go diving. As a recreational diver, you plan all your dives as no decompression dives. This means you can always ascend directly to the surface without having to stop, yet without significant decompression sickness risk. This is also called no-stop diving because you don't have to stop, though you usually will for extra conservatism. Dive tables have been around since 1907 and were the primary dive planning tool until the rise of dive computers in the 1980s. Although you'll use computers most of the time, you still learn to use tables. First, because it helps you understand what your computer does, and second, because computers can fail. If you have tables, you won't miss out on all the fun. Most dive tables were designed for military or commercial diving. However, you'll be using the Recreational Dive Planner, RDP for short, the only dive tables designed and tested exclusively for no-stop recreational diving. You'll learn to use either the table or the wheel format of the RDP. Dive computers do the same job as dive tables, and they do it the same way, by calculating how much nitrogen you theoretically have in your body. They're no more or less valid than dive tables. So don't let the electronics, displays, and digitals impress you. The computer's advantage is this. Being printed, dive tables provide a series of dive profile approximations that you fit your actual profile within. A computer, on the other hand, integrates a depth gauge, timer, and software to write a custom table for your exact profile, updating it as you go. Computers are more convenient to use and help minimize human error. Dive tables have to assume you spend all your time at your deepest depth, but computers give you more no-stop time in a multi-level profile by crediting you for time at shallower depths. The wheel version of the RDP lets you get multi-level credit too, but not as precisely as a computer because computers follow your profile more exactly. Computers track your nitrogen levels throughout the day, which isn't difficult with tables, but computers do it automatically. Computers have disadvantages, the primary one being that they can fail before, during, or after a dive. So be sure to have tables along for backup. Computers will also provide numbers for dive practices that aren't recommended, so don't turn your brain off when you turn your computer on. And computers give more no-stop time by eliminating rounding, but you give up the extra conservatism rounding provides. But given the advantages, it's more unusual to see a diver without one than with one. This is why it's one of the first pieces of equipment you'll want to invest in. You'll learn more about diving effectively with a computer in Section 5. Dive tables and computers tell you your maximum dive time without required decompression stops, the no decompression limit. But they also account for nitrogen you absorbed on previous dives. This is because when you surface, you have excess nitrogen in your body from the dive. This is called residual nitrogen. In theory, it takes several hours, even longer than a day sometimes, for all the residual nitrogen to leave your body. If you make another dive while you still have residual nitrogen, you are making a repetitive dive. You have to account for the residual nitrogen in your body when determining your no decompression limits for a repetitive dive. Before your first dive, your nitrogen level is normal. After your dive, you surface within accepted limits, but you've got more nitrogen than normal. During your surface interval, your body eliminates some of this nitrogen. But if you make a repetitive dive, your nitrogen level equals the nitrogen left from the first dive, plus what you absorb on the repetitive dive. The recreational dive planner and dive computers allow you to track changing theoretical nitrogen levels so you can determine your allowable no-stop dive time. How long you have to wait before a dive isn't considered repetitive, depends on the dive table or computer. With the RDP, if you don't plan to dive for 6 hours, residual nitrogen has little consequence. If you do dive within 6 hours, you have to account for the residual nitrogen, which is pretty easy with the RDP. You'll learn to use the Recreational Dive Planner with the Instructions for Use study booklet that comes with it. Before you get started, let's go over the general rules you follow when using the RDP. Bottom time is the total time in minutes from when you begin your descent to when you begin a direct ascent to your safety stop and the surface. Some divers time from descending to surfacing, which is fine because it's more conservative than the true definition of bottom time. Plan dives shallower than 10 meters, 35 feet, as though they were to 10 meters, 35 feet. Use the exact depths and times shown on the RDP. If your dive falls between shown depths, use the next greater depth and/or time. Ascend at 18 meters, 60 feet per minute or slower. Slower is fine. Be a safe diver. Slowly ascend from every dive. Be conservative and plan your dives well within the RDP limits. Avoid the maximum limits shown. When planning a dive in cold water or under strenuous conditions, plan your dive as though it were 4 meters, 10 feet deeper than it actually is. Plan repetitive dives so they're to an equal or shallower depth than the previous dive. The vast majority of scientific data about decompression is based on deep to shallow planning, so diving this way keeps you within profiles with proven reliability. Limit your repetitive dives to 30 meters, 100 feet or less. Limit your depth to your experience and training. For newly certified open water divers, 18 meters, 60 feet. 30 meters, 100 feet is the recommended general limit. With 40 meters, 130 feet, the absolute maximum limit for recreational divers who have the experience and training required. Plan your dives well within RDP limits. Note that 42 meters, 140 feet appears on the RDP for emergency purposes only. Don't dive that deep.
Done that about 85 times.
By now, you're pretty comfortable in the water. Good. Let's take a look at what you'll be doing in your fourth confined water dive. For starters, you'll be doing some stuff without scuba gear. Skin diving. Why, you ask? Because skin diving goes hand in hand with scuba diving all the time. It's an easy way to scope out a potential scuba site fast. Or the water may be so shallow, you don't need scuba. You'll use the same gear you use for scuba, except the scuba. And you'll either use a bit less weight than usual so you're positively buoyant, or you'll wear a snorkeling vest. Without a tank, you obviously hold your breath when you swim down to look at something. To extend breath hold time, you can use hyperventilation, which is simply taking 3 or 4 rapid, deep breaths before holding your breath. Hyperventilation reduces the carbon dioxide in your system, And since it's carbon dioxide that stimulates breathing, you can go longer before you feel the urge to breathe. But hyperventilate no more than 3 or 4 breaths. If you do more, you can blow off so much carbon dioxide that your body runs out of oxygen before you feel the need to breathe. This would cause you to black out without warning and drown. Don't hyperventilate excessively. And rest a minute or so between dives. If you feel fatigued, dizzy, or lightheaded, stop diving down and catch your breath at the surface. Since you're holding your breath while skin diving, you want to go down fast with minimal effort using the head-first surface dive. Goes like this. Deflate your snorkeling vest if you're using one. Then swim like this, hyperventilating 3 or 4 breaths at the same time. Hold the last breath, bend forward and thrust your legs straight up like so their weight drives you down. Kick when your fins come under, equalizing like you do with scuba as you head to the bottom. As you come up, look up, reach up, and be sure you have a clear view so you don't run into anything. Your buddy waits at the surface while you're down, and vice versa. That's so he's got a fresh breath if he needs to come down to assist you. There's an easy way to clear your snorkel when you come up from a skin dive, called displacement clearing. Note that when you look up, the snorkel tips lower than the mouthpiece. Exhale through the final few meters or feet, and the air pushes the water out of the snorkel. Keep exhaling as your head rolls forward at the surface, and hey, your snorkel's clear. But this only works if you have a snorkel with no self-drain, or a small self-drain valve. If you have a bigger valve, the air bubbles out instead of clearing the snorkel. No big deal, though. A valve that big means it's super easy to blast clear anyway. After you've skin dived a bit, your instructor will get you back into your scuba. You may practice the sitting back roll entry, which is great from a low, unstable platform like a small boat. Sit at the edge of the platform, make sure all your gear's in place, put some air in your BCD, check the entry area, then lean back while holding your mask and breathing from your regulator. Keep your legs tucked so your feet don't smack the edge. You might feel disoriented a moment, then you pop up. Let your buddy know you're okay and clear the entry area. You already know how to remove and replace your mask, so now you'll practice swimming without it, like you might if you had to surface after losing it. Remember to breathe through your mouth and exhale through your nose if you feel water tickling it. Open your eyes. You'll see well enough to swim. If you're wearing contacts, don't. Let your buddy guide you so you don't lose them. Okay, time to demonstrate what a pro you become with buoyancy. You're going to hover motionless for at least 30 seconds without using your fins or hands. Start by getting neutral on the bottom, then gently push away from the bottom a short ways. Don't hold your breath, but use your lung volume to maintain your depth. If you begin to rise, breathe with your lungs a bit less full, or a bit more full if you start to sink. It helps to find a visual reference, like a mark on the pool wall, to gauge where you are. Practice, and it's easy. Confined Water Dive 4, here we come!